Good morning, this is Dr. Hashimoto here to talk about knee exercises. So there's a variety of different knee exercises. Obviously, if your knee hurts, kneeling down like this might be a problem. The first exercise we're going to do is called the Mulligan ankle glide. You could simply put like a little pillow underneath this knee. The trick with this one is that you have one leg, now go slightly on an angle right here. You got one leg right here, and then you're going to glide forward over this ankle. This is not a hip flexor stretch, this is a Mulligan ankle glide. And then after that, what we're going to do is we're going to go into a psoas stretch, which is you're stretching and getting this part right here. Now there's some common mistakes that a lot of people do, is when they're gliding forward like this. Now if we're doing this for knee pain, that's going to put too much of a valgus stress on the knee. So you want to make sure that you're going to go straight forward, keep your chest up, and you're going to come forward over the ankle. And the idea behind this one is that we get increased mobility in the ankle right here, which will take some stress off the knee. So you're going to do 10 of these each side. Obviously, that means bilateral. And then you're going to follow that up with a psoas stretch, and then you're just going to come forward like this and hold that for 20 seconds. So most people, when they work on the knees, they're only going to work on the knees, and doing a psoas stretch is going to work on the pelvic balance. Another exercise that I love to do is the rolling stick. You get these in a running store, you get it in our office. It's a therapy stick, and then you're going to use this to roll up and down the leg, up and down the side of the leg. You don't have to sit here and do it for hours. Literally 1 minute a leg twice a day is all you need to do. You're going to do the inside, you're going to do the outside, and then you're going to do the quad. And obviously we're going to be doing that bilaterally. Foam roller is another great one that I love. For the knee, basically we're going to come over here and you're going to roll over the whole iliotibial band. And then I'll use one leg right here for balance, one hand here. You're going to roll over the back of the hip, get that back part of the glute. You're going to get the side of the hip, and you're going to get the whole iliotibial band. Obviously, getting it in a bigger area is going to be best for you, and that's going to loosen everything up. You can also turn it over like this and quickly roll over the quads. So now you've loosened up all the muscles around there, and now we're ready to get into some other exercises. Hamstring stretch. So different ways that you can stretch the hamstring. Obviously I'll go on an angle right here. If hamstrings are really tight, you could just start with a dynamic one. If you have more flexibility, you could go into a stretch like that. And if you don't have as much flexibility, a towel or a strap around the foot and stretching that up and holding that for 20 seconds is all you need. Again, we're going to be doing that bilaterally, and then we can follow that up with a piriformis stretch. So cross one leg up like this, one hand down like that. That might be enough for you. If you have more flexibility than that, you can reach through and then just stretch that. The idea is that that stretches through here. What I'm doing is I'm reaching through the hole right here, kind of grabbing onto that femur right there. Other one that we do is a leg lowering exercise. Really easy to do. Basically, you're lying back here. The trick to this one is that you got your back flat. And then what I'm going to be doing is I'm going to be lowering a leg down, not letting it touch, and bringing it back up, and then lowering it down and not letting it touch while maintaining that back flat. That's too easy. You just start like this and just do alternating the legs. The big trick with this is maintaining that flat back and having lots of control. That's going to isolate the lower abs. Lower abs are going to stabilize the pelvis. Stabilized pelvis is going to help your knees stay in proper alignment. And then another one that we could roll into while we're flat on our back is the bridging exercise, which you're going to be coming up like this. You want to keep that pelvis nice and level, and then coming up like this. And that's going to work the glutes, which is the other side of the pelvis. If this exercise is too easy for you, you can simply lift the leg up like that, and that's going to work the lateral part of your glute. From here, we can roll straight into a lateral glute exercise. This is called the clam. A very common mistake with this is that you have the hip roll backwards like this. So if you keep it rolled forward like that, keep this hand here, and then you're separating your feet here. The purpose of having two hands here is keeping that pelvis roll forward, and that's going to work the lateral part of your glute. Lateral part of the glute is very important for knee stability. And then another exercise, you can do this with a pillow. This works the adductors. Is right here, put a pillow between your knees or the foam roll. You're squeezing it, and that's working the muscles on the inner thigh. So now we've worked muscles all the way around. Now for the quads. So for some of you that are a little bit more elderly, just sitting here and squeezing the quads, lying flat on your back, it's going to be enough. If you want a little bit more activity out of the quads, you could go down and do a wall sit. 90 degrees, 90 degrees. If you want to work your shoulders, you're going to come up here and basically you hang out here until your legs go on fire, and then you come back up. So that's a little bit more of an advanced one. Over here, standing behind the chair, obviously, to work the calves, you can stand up on a block or just practice going up and down. Notice that I'm going up and down right here. If you want a little bit more, you can stand on a phone book and then just kind of come up like that, and that's going to work that. Another way to stretch the quads is a standing quad stretch. If this is too much for you, then obviously I recommend hanging on to a chair, probably a more stable chair than this. And then the trick with this is that you want to make sure that everything is lined up like this. You don't want to have your leg or your body twisted like that. So if you can't get into this position like this, then maybe it's best that you use that strap that you use to stretch your hamstring and do it face down on your belly. And then the other ones, you could use the chair for balance, but basically that's going to be a side-to-side lunge. Coming down here and holding it for 20 seconds. Now we've stretched all the muscles, front, back, around the quads. We've done the calves, and then we've strengthened everything around the knees and also worked on the pelvis. That's a very simple knee routine that almost anyone could do. So that's Dr. Hashimoto signing off. Try those knee exercises at home. I have them written down in case you forget.